Hello, learners. Welcome to our discussion on surgical hand scrubbing. Today, we are going to discuss the sequential steps for a thorough hand scrub. This would be a scrub that operating room personnel would perform at the beginning of each day prior to the first case. The reason we perform a hand scrub is to remove microorganisms and pathogens from our hands and fingernails. These lead to surgical site infections for our patients. Those lead to additional procedures and costs and unnecessary heartache for our patients. So we want to avoid those at all costs. You want to begin by doing a thorough hand washing with soap and water. Next, you will choose your product. We have brushes that are impregnated with antiseptic products for the hand scrub. These brushes come with a nail pick. So you want to open the package, turn on your water, lather up the brush, use the pick to clean under each fingernail, discard the pick. Then you want to start by viewing your hand as having 4 planes, top, bottom, 2 sides. Use the brush side of the sponge to scrub and clean under your fingernails, and then move to the sponge side of the brush. Start with your thumb and clean each finger working outward, then go to the back of your hand, then to the palm, and then we'll start working our way up. You can use the timed method or the brush stroke method. I like to use the 10-stroke method. In this, you start with the thumb, 10 strokes on the top, 10 strokes on the bottom, 10 strokes each side. Work your way through all 5 fingers. Go to the back of the hand, 10 strokes on the back of the hand, 10 strokes on the palm, and so forth. Continue once the hand is completely scrubbed. You continue up to the wrist, working your way up the arm. If you divide your arm into 3 sections, you want to work your way up the arm, ending about 2 or 3 inches above the elbow. You also want to remember to keep your hands up and let the water run down towards your elbow. If the water runs back towards your clean hands, it's considered contaminated and you will need to start the entire process over. And now you have completed your surgical hand scrub and you are ready to enter the operating room and prepare for gowning and gloving.